Meniscus is a fibrocartilaginous tissue located in the knee. The menisci, we have two menisci in each knee joint. One is called medial meniscus and the other is called lateral meniscus. Meniscal tissue has a role of suspension in the knee joint. It has also a role in contouring the knee joint, particularly if we think that the proximal tibia has a flat surface and then the distal femur has a convex shape. Menisci kind of makes the contour over the tibial plateau to have good contact with the distal femur. We have some meniscus diseases, and most commonly known meniscal problem is meniscal tears. Meniscal tears can happen in patients with sports injuries, particularly in young age group. It can happen during playing football, soccer, basketball, or other sportive activities. And in young age group, menisci tears can happen with severe trauma like twisting of the knee joint. However, in elder age, menisci become degenerated. Because of this degeneration, they can be torn easily, like getting on the bus or getting off the bus or just sitting down or just in crouching position, we may have the menisci tears. And then the treatments are a little bit different. In young age group, menisci tears needs to be treated and either surgically or conservatively. In menisci tears, the important thing that we may have peripheral menisci tears or central menisci tears. If the tear is peripheral, then it's in the area that can have the nutrition, blood supply, and can be healed. Because of that, if we have the peripheral tears, and if they are small, we just give some time to the patients, it can be healed by itself. Or if they are big, then we opt to suture the meniscal tears located in peripherally. The peripheral section is about 10 to 15% of the total meniscus body. And then if the tear is in the central part, then usually we kind of prefer to excise the torn part of the menisci. And this is called partial meniscectomy. And then with the partial meniscectomy, we still have the big portion of the menisci intact. That's why patients are not supposed to have any problems in their future life. In the elder population, if we have the menisci tears, if they cause any locking or any symptoms, then we can operate on them. But the operation is excising the torn part of the menisci. We don't prefer to sew the degenerated tears since they are not supposed to heal. And the other thing that in the degenerated meniscal tears, if they are not causing any locking sensation or any problems, we usually don't operate on them because patients may have already, the osteoarthritis of the knee causing the problems, and just treating the meniscal tears will not affect the end result so much.